Ready to go? All right. Welcome everyone to our Fall into Beauty event. I'm here with all of our non-surgical providers and we are going to take you beyond the needle. I'm Heidi. I am a physician assistant here at L&P Aesthetics.
I am Mandy. I'm one of the nurses here.
I'm Nurse Ginger, one of the nurses as well.
And I am Liliana, one of the nurses.
So if you have any questions, please feel free to drop it in the chat box under the Q&A at the end. We will be happy to answer all of them. If you can see on the screen, there's a little circled area where you use that icon to take you to the question room, and we'll get to all your questions at the end. Also, I wanted to let you know that tonight only, we're having 20% off all our medical grade skincare products, so please take advantage of that. We only do it tonight only. Go to forthefaceskincare.com. The code is Fall Into Beauty. It's a great time to get stocked up on your own products as well as any gifts you might want to get. Heidi? Or Mandy?
I think it's me. Okay. So why the needle? And we wanted to spend this time talking to you guys about the non-surgical treatments that we do that aren't injectable. So we do a ton of Botox, a ton of fillers. There's always going to be a place for that. Ideally, you guys are seeing us every 3 to 4 months for your injections, and we're kind of taking you on that injectable journey. But what we really believe in is in the anti-aging is doing also things that stimulate collagen and break down the dermis, and it all plays together. We spend a lot of time trying to educate on these devices, but we found that as we have this great array of devices here, sometimes patients get overwhelmed. So we wanted to just walk you through the journey of all of our different devices here, and help just to educate you, answer some questions. So bear with us. We are going to get to our Botox talk, but we're going to talk to you about our lasers first.
So we're going to talk about all of our non-surgical devices that complement, like Mandy said, all of our injectable treatments as well as complementing our surgical procedures here. So there are multiple types of laser and devices that can induce collagen production, lift and tighten skin, and resurface skin texture.
And this is our beautiful staff here. And what I love about this photo is a lot of patients are worried about devices and lasers because they may have a more olive skin tone or a darker skin tone. We have a device or a laser in our office for all skin types. And when we talk about skin types, we're talking 1 through 6. 1 is a really light, blue-eyed, redhead, blonde hair that can really tolerate any device. And then we go up to Dr. Parik's skin type there that we still have options for that skin type, but there is really something for everyone. I know a lot of people are scared based on their skin type, but I love this picture of our beautiful staff that really represents Fitzpatrick 1 through 6.
So I'm going to talk about what I like to call as like the starting kind of device for people getting into aesthetic procedures. We have Cyton's broadband light device here, goes by the name of BBL. Other comparable devices are IPL, intense pulse light, sometimes also called photofacial. These devices it's not a true laser, they're a light-based device that is great for pigmentation, red and brown pigmentation. It basically kind of pulls that color to the surface of the skin so you look worse before you look better. It also stimulates a bit of collagen and helps to invigorate the skin, boost your body's natural collagen response, and correct signs of sun damage, rosacea, broken capillaries, and any kind of dyschromia, discoloration on the surface of the skin. It's great for faces, necks, chests, and hands. The procedure is fairly quick. There's no downtime to it. It does involve some gel. So there's a gel that's applied to the treatment area prior to the procedure, and that serves as a conductor. So for this device to work, we have to have that gel on, which can make it a little bit messy. So if we're treating your neck or chest, we'll usually have you change into a robe. The ideal candidate, so unfortunately this is a great device, but it's not fit for every skin type. So the ideal candidate is typically a skin type 1 through 3. Sometimes we can do it on a skin type 4. Usually we have those skin types prep their skin before we do the procedure. And the main thing, I think the main thing that's great about this procedure is that there's really no downtime. So you don't have any open wounds on your skin. You have to be careful of sun exposure afterwards, but you can also put on like a tinted sunscreen, foundation even, to kind of cover up the healing process while you're letting your skin heal and the pigmentation comes to the surface and then disappears over about a 7 to 10 day time frame. So in conjunction with BBL, we always like to recommend some good medical grade skincare. So of course you'll need a mineral-based sunscreen to protect you as you're healing. And then typically a gentle cleanser or a gentle moisturizer. And really that's it. So you won't use any of your medical grade retinols or your vitamin C's or anything like that while you're healing. But the regimen is pretty darn simple and you can pretty much go about your daily life while you get to enjoy the benefits of a BBL treatment.
Okay, so I'm going to chat with you guys about microneedling. We have 2 ways that we microneedle in our office. One is with the pen. That is what we often call cold microneedling or plain microneedling. We can do that with or without PRP, and I'll get into that. Or we have the big daddy of microneedling with radio frequency. So what is microneedling? Microneedling is my favorite thing for all skin types. You can use it 1 through 6. I really do feel like it's probably the lowest risk device here with the biggest benefit, right? I mean, we're inducing collagen. You have little tiny needles that are penetrating the skin, and we're making little holes in the skin, and then we're infusing either PRP or a nice hyaluronic acid to help with hydration and but we're really breaking down the skin, inducing collagen. Anyone can do it. All right, so let's talk about microneedling without PRP. So without PRP, that means no blood draw. A lot of people have heard of vampire facial. Microneedling without PRP is still very beneficial. The little needles are going in, we're infusing a hyaluronic acid. I don't think my patients have any pain. Most of the people are laughing at like pickles or they want to sneeze, but it really is like a pain-free procedure. You'll numb here in the office for about 20-30 minutes. We'll use a nice HA. You're going to be red for a few days. I usually, your first time, I tell you, give yourself 3 or 4 days, but then we can kind of judge a couple of days, really. And then with PRP, so what PRP means, and I think on the next slide, we'll kind of show you the process, but so go ahead and go to the next slide if it's okay. So here's what we do. We'll numb you, we'll draw your blood. When we take your blood, we'll put it in a centrifuge. It spins it really quickly. Once the blood is done spinning, it leaves what's called your platelet-rich plasma, and it's full of stem cells and growth factors. Once we cleanse the skin, we use the pen, very similar to the pen that we use without PRP. Those little channels are going in, but as those channels are open, we're infusing your own blood products. Helps you to heal quicker. I really like PRP for acne-prone patients because I find less kind of problems afterwards with acne because we're not infusing any products that you may kind of react to. It really is the gold standard in microneedling, and you can take a day or 2 off your healing time when you use the platelet-rich plasma. Just go next slide. So right after, you can see this beautiful patient is a little bit red. There's a little bit of pinpoint bleeding. You're going to look like you've had a sunburn for a couple of days. Every once in a while, if we're getting close to the eye, maybe like minimal risk of bruising, but it's really just like uniform redness. You're going to look like you've got a sunburn. Nice to wear a mask. You can kind of cover it up, put your sunglasses on and hide away. But we really want you to be gentle with your skin, staying out of the sun. Once you're healed from it, a week later, your skin feels so soft. The real benefit of microneedling is several months later, actually, as you're stimulating collagen, you're kind of rebuilding the building blocks underneath the skin. So Morpheus. Morpheus is probably the hottest topic in the office.
Oh, yeah.
Hottest topic with my patients, hottest topic on social media right now. It is super, super popular. It is an awesome machine. The reason why we brought Morpheus into the office is our doctors found a small gap in our practice as far as patients who weren't quite ready for surgery, but were looking for some lifting and tightening. Okay, so we had to find a way, we really wanted to pick the best device on the market, which is why we brought Morpheus in, and our patients are loving it, we're loving it. It does similar to regular microneedling. You're getting fine lines and wrinkles and collagen induction, but you're also heating up the skin to hopefully lift and tightening. What we're finding is our patients have all this new kind of plump skin. Like when you look at your kids and you're like, what is it about their skin? And it's just so squishy and plump. Morpheus is doing that for our patients. It's just really nicely revolumizing. It's breaking down scarring, and it really, it's beautiful on neck. So I never do a face without doing a neck. It's really kind of flows all together. It is super popular. Next slide. So the technology, that is the handpiece there. The little needles, we numb you for an hour. We also have Pronox here, which is nitrous oxide. So you can have a little puff on that. Feels like you've had a couple cocktails. And then the little device, the needles go in, they give a little dose of heat. Beep, beep. It sounds like a little video game. Takes about 30, 40 minutes, and then you're done. You just have to do it 3 times afterwards. I usually tell patients similar downtime as regular microneedling. Red for a couple of days, maybe a little bit itchy. The neck can kind of hang on there a little bit longer, a few extra days, but really gentle with your skin. Think of those little needles that poked all those little holes. You want everything to heal really nicely. You don't want to be putting product down there that's not meant to be. So you have to use the recommended skincare. So tonight is a night. You get your beauty bank. You get your skincare 20% off, and then you're all ready to go. So Zeo is my all-time favorite for post-microneedling and Morpheus. Gentle cleanser, hydrating cream. Of course, you're going to be on mineral sunscreen. And these are great products to use even after you're kind of done healing. I use these in my everyday routine as well. But tonight's the night to get them, so don't forget to go on to the For the Face Skincare Beauty and get those 20% off.
So Moxi Laser. Moxi Laser is our introductory laser. It is a great treatment when it comes to giving you that polished and refreshed look. I personally have never had any laser treatments. And just last week I was able to get my first Moxi. So here is a video of me during the treatment.
The reason why I want to do Moxi is because I definitely need help with my pore size. I'm also noticing some fine lines around my eyes. I would describe it as a spicy feeling. This is actually my first laser, so I'm really excited to see results.
Next slide. So Moxi has many wonderful benefits. This treatment is actually great for anyone who has uneven pigment. It's going to help with fine lines and wrinkles. It's going to give you a good dose of collagen, which is something we all want. This picture is a real Moxi patient who was fascinated about her glowing skin after her first treatment. So what is Moxi Laser? Moxi Laser is a gentle resurfacing treatment. What it is doing is creating microscopic little channels into the skin, and it's stimulating collagen. This is ideal for someone who has good skin with mild correction, or for someone who has had any other resurfacing treatments who kind of just want to maintain the results. And many of you might be wondering, like, what is the healing process? What is the downtime? Downtime, there's about 7 days of social downtime. The healing process is not bad at all. This is a picture of me immediately after my treatment, and I am a little red. I was hot, but that heat went away after 2 hours. And based on my personal experience, it was a spicy feeling, but not too discomforting. And then day 3 here, my skin just kind of felt like sandpaper and really tight. And then on day 7, my skin was glowing. So who is the right candidate? Well, this is ideal for everyone. It's safe for all skin types. You can do it all year round. And this is a picture of Dr. Liverman and Dr. Parikh. As you all know, they are very busy, so they really never have the time to do any aesthetic treatments. But luckily, last week we were able to give them a Moxi facial, and just so they could actually try it for themselves, and they loved it. Their skin is glowing, and they're very happy with the results. So here are the top 2 products that I highly encourage patients to be on when they get any Moxi treatments. This is our CO Gentle Cleanser and the Gen-Marine Physical Sunscreen. So if any of you are interested in getting a Moxi, make sure you go on to forthefaceskincare.com. Use that code Fall Into the Beauty to take advantage of that 20% discount. So now I'll go ahead and pass it out to Ginger.
Okay, so I'm going to talk about Halo. Halo's been known as the Moxi's big sister, so it's a little bit more aggressive than everything Eliana just said. Why somebody would choose it? If you're bothered by your sun damage, your pigmentation, if you feel like your pores and your texture just looking a little rougher, just a little thick. Also, if you have fine lines, wrinkles, this is the treatment you would choose. Who wouldn't want that? We all love that. So how does Halo work? So technically, it is an ablative and a non-ablative laser. So what does that mean? So I heard an analogy the other day that the ablative is like mowing your lawn. You cover your whole lawn when you cut the grass. So that is treating the whole top surface layer of your skin. Then the non-ablative is like aerating your lawn, so creating little microscopic channels in your skin. Why you do this is a couple reasons. One, when you do those controlled channels, it stimulates collagen. Collagen is what helps smooth out our skin, soften those pores, those textures, those lines. And then also all those little channels push up new skin cells. So that's what helps to slough off your pigmentation and make you look like you have clear, glowing skin. They call it the halo glow. So what's involved in the process? So a couple weeks before the treatment, we have you prep your skin with Elastin Skin Nectar. It gets your skin ready for the treatment. For patients that have a little bit more pigment in their skin, we also get them on a hydroquinone product. We like Obagi Clear, and you prep your skin for a couple weeks, as well as being very mindful of using your sunblock. The day of treatment, you come in, we numb your skin with a topical numbing cream for an hour. We cleanse your face after that, and then I simply just roll over your skin, delivering those 2 levels of laser. And then the treatment is done. Next slide. So this is Mandy's twin sister. She did a fabulous job recording her recovery. And everyone's going to have a slight variation of this, but this will give you a good idea what it's like. So the first slide is her before, little sun damage, little texture. The next slide over is her immediately after. You can see her starting to get a little red, a little swelling. Right here is when you're the most uncomfortable because all those little channels, the heat is escaping. So you feel pretty sunburned for a couple hours, and then it just turns itself off. The next day is considered day 1. You're going to have more swelling, more redness. And then from there, the next several days, you're just shedding your skin. And then that's when you're going to get your halo glow. It may not be exactly the day you finish shedding. Maybe, like a week or 2 or 3 after is when you really get that fresh new skin. But what I really like is combining it with the BBL that Heidi talked about earlier. So if you have more superficial pigmentation, if you have a lot of broken vessels or generalized redness or rosacea, and you combine it with Halo, we call it the Halo Bliss, and that is just my ultimate favorite treatment. My favorite products to use, again, is prepping your skin ahead of time with the Elastin Skin Nectar, and also using that during your healing process, and you will heal much quicker, along with a good sunblock as well, and I like Alto MD. So next is Heidi.
So here's the question we get all the time: which laser or device is right for you? And that could be an open-ended question because for certain skin types, you could pretty much do any of the devices that we just talked about. For other skin types, because darker skin types have more melanin in the skin, certain procedures are not for that particular darker skin type. and or not the best for that darker skin type. There are also some procedures where we can kind of are appropriate for kind of that mid level, like 3, 4, even maybe into a lighter 5. That's okay. But then in order to get some of these devices, we need to have you prepare your skin. So you would have to use some sort of topical lightening solution like the hydroquinone that Ginger talked about before you proceeded with any of these devices. Also, for all of these devices, you need to be mindful of your sun exposure and self-tanner prior to any of these devices. So timing is always key with respect to, have you, been on a tropical vacation? Are you planning to go on a tropical vacation? Do you do self-tanner weekly? All those we have to take into consideration with timing of the device. These are all not a simple one and done procedure either. Some of them require a series to just get you started. So for instance, for BBL, if you've never done any kind of laser light-based device, microneedling, we always have you start with a series because we want to get your collagen ramped up, going, get rid of that pigmentation, and then there is maintenance required. So just like your car where you have to change your oil, change your tires, we are not any different. We have to maintain ourselves as well. So once you complete a series of these, then it's recommended that you at least do one of something every year. So the cool thing though about all these devices is you can kind of mix and match them. So if you haven't done, one, or you haven't done any of them, you can kind of start with something that's maybe a little more simple with less downtime, like the BBL. I think that's why I love that device, because it's pretty simple to recover from, it's easy to have done, and you get a great result. So you could perhaps do a series of BBL 1 year, and then the next year go, okay, I'm going to maintain and do one BBL, and then add on a halo and do the halo bliss. So there's many options for you to do. And everything's just, based upon your goals. So all these devices, as I said, kind of when we started, can be comboed with all of our injectable procedures, and they can also be comboed with our surgical procedures.
Okay, well now it's our Q&A section, so please ask us anything you have in mind, and we're happy to answer as many as we can before we get to the giveaways. So Mandy, what's our first question?
Okay, I'm going to kind of group a couple of these together because I'm just scrolling through and a lot of you have asked very similar. So I want to quickly ask the one that says from Kimberly, which laser works best for wrinkles around the mouth? I think this is like one of my, and I'm going to turf this because I don't want to get too far into it, but in my opinion, and you guys can answer, I think it's TRL, which is not on here. That's a doctor level laser.
Right.
But if you don't want to go to that level, then Halo would probably be a great option for that.
Yeah, I think Halo is kind of right below there, but if you want to fully get rid of them, then TRL. So anybody who's asking, there's a few questions on here that I see about like CO2 laser. We have a laser called TRL, which is a tunable resurfacing laser. That is a doctor level laser. They're going deep down. I'm going to kind of let them chat about that at some point, but yes, we do have a great option for that. Heidi, our PA, also does some of our TRL. So something you should look for in consult for that. All right. There's a lot of these there. Okay, so let's see. What would you recommend for melasma-prone skin? Ooh,
The toughest skin condition, I think, to treat ever. That and acne scarring. Not acne, but acne scarring. Those are probably the top two things that are just very challenging. So your expectations have to be reasonable and not too high.
Yeah.
We don't treat a whole lot of melasma here because really it's quite difficult to treat. And I think the best thing for that typically is topical skin lightening products and perhaps some chemical peels that are appropriate for melasma.
Yeah, I agree. And just being really committed to it. We can't get rid of your melasma. We can help you control.
Right. Yep.
Okay, lots of Morpheus questions. Okay. Does Morpheus provide the same results as all therapy? Ooh, that's a tricky one. It's the same idea, right? I think what I tell people is we're lining every device up. Everybody's trying to stimulate collagen. it's hard to lift and tighten tissue. If you want this beautiful jawline, that's surgery. We're trying our best. Yes, there are still old therapy candidates. Morpheus, I think in our practice, has kind of taken over most of that lifting and tightening, and we see really beautiful
People
results.
find it a little more comfortable as well during the treatment with Morpheus.
Yeah, and I do think because old therapy treats columns, Morpheus is full face and neck, you can really get like really nice results with pore size and fine lines, rather than just the lifting and tightening. All right. So many questions. Do you have to avoid retinol before Moxi? It looks like someone answered that on there, but do you want to? There's lots of questions about prep for Moxi.
Yes, I would highly encourage them to avoid retinols at least a week before your Moxi treatment.
Sorry, some of you were saying it's difficult to hear. I apologize. Okay, does Morpheus use a laser? That's an interesting question. Morpheus is not a laser. It doesn't use laser technology. It uses radio frequency
Energy.
Energy.
Yeah.
Exactly.
And the microneedles. So it's more of a device than an aesthetic device is how I would describe it, as opposed to a laser or light-based device.
Are there any limitations to these treatments for breastfeeding women?
A lot of times we have to numb the skin prior to the treatment, so most women probably want to stay away from the numbing cream prior to their treatment, so they'd have to finish breastfeeding before we get started.
How often do you need to get Morpheus? Well, Morpheus is one of those things that Heidi talked about as far as like an on-ramp. We usually have you do 3. That's the package. So we'll kind of talk to you in a little bit about our beauty bank in order to get you started on that. And then once a year, you should use it to maintain or do something once a year. And like she said, I think maybe 1 year we do a halo or you do a Morpheus or, you're maintaining with Moxi. This is not something we view as like, you're just going to come here and use and we're never going to see you again. Like that's why our injectable patients, we really want to take you on this journey because there's something we're going to do once a year. There's options and I think we'll mix and match them based on what your concerns are, but ideally at least something once a year.
Yep.
Okay. All right. When would you be able to, would you be able to go over treatments to get when you're first starting out, say 25 years old? I think this is a great.
Oh, this is a good question.
Great.
Yeah.
What's the question?
What would you do starting, say, our young patient? So once she's young, at 25 years old, what should you do? I've heard of microdermabrasion, but wondering what you recommend. We have a lot of young patients.
Moxi or microneedling.
Yeah, I think that's
a good introductory place to start when you don't have a whole lot of correction, but you want to stay ahead of the game so you don't, you want to hold off the bigger lasers. It's a great place to start, microneedling or Moxi.
I'm now entering my mid-30s and have done BBL. I'm interested in going to the next level. What would you recommend for intense anti-aging treatments? Good question.
If you've done the BBL, that's a great place to start. That one's something that we'd have to see you, but either it would be the Moxi, the entry-level laser, or the Halo, which is a little bit more aggressive. Probably my favorite. It's a great thing to keep your skin polished, do any correction that might be developing. And that's something maybe just once a year, once every other year, depending on your age.
Yeah, I love it.
And if you love the BBL too, then you can do the combo, the Halo Bliss, where you do a BBL and then that same day you get the Halo. So you have like one treatment setting, one kind of healing process, and you can do that annually. And it's fabulous to kind of keep that collagen going and help with pores and pigmentation and all that.
How much should I budget per year for maintenance treatments after TRL and surgery?
Ooh, that's a good question.
Protect your investment, girl. I think that's a great question. And I try to, when I see the post-op say like, now it's time to protect your investment. I mean, I think seeing us for injectables every 3 to 4 months, there's always going to be a place for volume for your filler here and there. For TRL, I think at least after TRL, got to give you a little bit of a break. You know, you've been through a lot of recovery, like, I don't know, at least once a year. You should do something once a year and seeing us for injectables. So plan on.
And then skincare too, like Deanna and Colleen talked about before us, like that's very important to maintain any of these results, especially after a TRL or surgery. But just after anything that we do, that always helps give you a better result and maintain your results. Even with filler and injectables, it helps as well with that too.
Okay. In the first treatment you showed with the light therapy, is it similar to the results you would get from red light therapy mask?
Depends on, well, I would say no. I mean, those red light LED masks are great for home use. There's even some studies on it that it does produce some collagen. And even if you went to see a qualified esthetician that did some red light therapy, that would be great as well. It's just not going to be as, I hate to use the word aggressive, but it's just not going to be as intense or something that can be done by a medical provider in an office setting. So they're not bad. They're great for, I have an LED mask at home. I do use it like 2 or 3 times a week just to kind of maintain everything. But I'm, you know, there's no downtime to it, which is great, but I'm just using it kind of for maintenance. So you're not going to see kind of the big results that you can see from in-office medical procedures.
You guys are so good with your TRL questions. I don't want you to think that we're skipping you. I'm going to turf that to Doctors Lieberman and Parikh though, because that's really their specialty, and I don't want to give you mixed information, but tons of TRL questions.
It is a fabulous procedure.
We're not ignoring you.
It's just it's a big procedure for sure.
Who do you recommend for microdermabrasion? You should see our estheticians. I think we all work in combo together, Deanna and Colleen. They do a beautiful diamond glow facial, which is a microdermabrasion. Can make sure you're on the right products. We all work really closely together. So you should stay with us. Okay, we only have time for one more. Let's see. Which treatment do you feel is best for aging skin that is not as firm anymore? I think that's a good question. So skin that's potentially starting to get like a little bit creepier.
So I would probably fall into that category.
Yeah.
So I really love both doing a Halo BBL Bliss 1 year and perhaps in the next year doing a series of the Morpheus for the collagen tightening and the texture as well. So there's never just one treatment. So I would either do it every 6 months or once a year and perhaps alternate.
Beautiful. All right, so we will try to, hopefully we can get to some of those questions in the chat, but happy to see you all in consult. I think.
It's giveaway time.
Woo! We know these are the moments.
These are the moments everyone is waiting for. Should I put it in my little Botox glass? So I am giving away the first gift is a New Beauty test tube box. So New Beauty, if you haven't seen it, is a fabulous, it's like one of my favorite magazines that comes out quarterly, features many dermatologists, plastic surgeons, our doctors have been in there, and they provide great real information on devices, products, new trends, things that are coming our way, that sort of thing. And so they have a test tube that basically gives people full sizes of new products on the market. So the first giveaway is for this New Beauty test tube. The value is $150, and the winner is Catherine Brenner.
Congratulations.
So congrats. So you can call our office or stop by to come and pick that up.
Okay. Next giveaway is our Zeo Skin
Ooh, I
Health.
love this.
Woo,
Basket.
this is a nice
This
one.
is a value of $450. I love this whole product line. We'll help you, teach you how to use all of them. It's a fabulous, fabulous gift. And the winner is Sandra Lamboy.
Woo!
So
Cheers.
Come on to the
Cheers.
office and pick it up this week.
Okay. next
Next
giveaway.
So the next giveaway is the microneedling with skin pen. The value is $600. Let's see who's the lucky one. Renee Packier.
Oh, congratulations. Do you think I should make them wait a little longer?
Maybe. Where are we at on time?
I
Let's
know-
see.
I know none of you are
Oh.
interested in that year of free Botox. So. Okay.
This is it.
Okay. This is super exciting. All right, you guys. Thank you for joining me so late. I promise I won't talk too slow. Oh, it's Stephanie Schmidt. Cheers to you.
Cheers,
Congratulations. You get a year of free Botox with one of us or all of us. So thank you all for joining. Next slide. All right, so not to leave out one of the most important things, the whole reason we're doing this, a lot of you ask us for like, do you guys ever give discounts? We really don't. So this is the time to get in on your beauty bank. Okay, I'm super excited because I don't think last year we did the $1,500 credit. I think if you're interested in, a little Botox in your skincare, I think that's okay. Most of you who are interested in doing like your Morpheus and your Halo, you really want to get in on that $3,000 to $5,000 credit. That $10,000 credit is awesome for patients who are really committed to their aging, their anti-aging process. Those are patients that see us every 3 to 4 months. They're doing something once a year. They're getting their skincare and their facials. I don't think there's anywhere that I know of that I can turn $7,500 into $10,000 like right away. So I think it's an awesome opportunity to really get in on the beauty bank. You have to buy that on our For the Face skincare website. So make sure that you log on there. And it's tonight only. When we're done, it's wrapping up and that's it. Up next, I know you've all been waiting to hear from Drs. Lieberman and Frake. They are going to be talking about Fearless Beauty. It's really about taking the fear out of plastic surgery. So make sure you tune in and listen to them chat. It's a really, really great talk. So have fun. Congratulations to our winners. This is me. Sorry, final slide. If you have any questions, our Zoom support room, Tiffany's in there. She's waiting to chat with you. Just the Zoom link is on our blog, fortheface.com/blog. We're here. I think Louie's still answering phones and stuff too. So if you need us, we're here to kind of help you guys get signed up. Make sure you get your beauty bank. We're not scheduling appointments tonight though. Really just trying to make sure that everybody gets the beauty bank onto their accounts.
And then we'd love to see you in for a consultation.
Thank you for
Thank
joining
you.
us.
Thank you.